So this patient was referred to speech pathology by her respiratory physician with a suspicion of VCD. The patient had a background history of reflux and obstructive sleep apnea, which had been treated. And her voice assessment results when she saw the speech pathologist showed mild dysphonia, and her questionnaire scores were outside the normal range. The purpose of doing the functional transnasal laryngoscopy was to confirm whether or not VCD was present. So Anne, I'm just going to put some spray in your nose. Okay, so I'm going to put 2 squirts in each side. Just sniff that back for me. Good. And we're going to time that for 3 minutes. So you just sit comfortably there. Brilliant. All right. Good, so I'll just get you to breathe normally for me and bring your chin up towards the ceiling a little bit for me. Perfect. Okay, just breathe in and out. Just bring your head to the midline. Perfect. Now big breath in and out. Good. Now I want you to say E. E. And again. E. Good. And again, a nice big long one now. E. And again. E. All right. Just count from 1 to 5 for me.
1, 2, 3, 4, 5.
Okay. And now say E. Up high. E. And down low. E. Now E.
E.
Good. And now E, 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 E.
E, 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 E.
Good. Sniff. Good. And just breathe normally. Thanks, Steve. We'll just open that lid now. So now I just want you to breathe in and out through your nose. Chin up towards the ceiling a bit more. Just to the midline. That's it. Yeah, right in front, thanks. Yeah. That's it. Just breathe in and out.
It's not a nice smell.
Okay, is that 30 seconds now? Yep, okay, good. Yep, okay, good. All right, just coming out now, Anne. Well done.
Thank you.
So what we might do now, Anne, is I can show you the video of this. You can see that's a little bit closer in there. This here is the back of your tongue. Okay, so those white things are the vocal cords, or the vocal folds. Okay. And this is the tube that leads down into your lungs. Now when you're breathing, do you think you want your vocal cords open like that or closed? What would you say?
Probably closed.
For breathing, so you want the air to
breathing,
go open. Yeah. So just watch what happens to yours when you're breathing. So they're nice and open there, and they're just closing a little bit at time. So when you're breathing, they're not staying open the whole time.
Like they're supposed to.
Okay. Now here is where we get you to talk. Okay, so your vocal cords are coming together. They're coming together quite well.
And that's when you're talking.
That's when you're talking. Yeah, but what we are seeing is these on the side here are called your false vocal cords, and they're coming in as well. So there's a little bit of muscle tension in there.
Oh, okay.
It's mild.
Oh, right.
Do you have problems with your voice?
Yes.
Yeah.
So I have problems pronouncing a lot of things as well.
Okay. Do you get a husky voice or lose your voice?
Yeah.
Yeah. Okay. This is where you're counting.
Oh, okay.
This is where Steve's given you the perfume, and you can see you're just starting to narrow a little bit there.
Oh, yes.
Okay, so it should be wide open, but you're closing down, not completely, but about over 50%.
Yeah.
And we've got some stringy mucus there.
That's from the perfume.
Well,
Is
the
that what
perfume
that's
wouldn't. The closing down is your reaction to something that you're perceiving as unpleasant,
Right.
and what's happening is your vocal cords are closing down at that point.
Oh, okay.
We'll book you in to see Belinda for
Yes.
to start some therapy to
Yeah,
try and get
righto.
some control over those muscles and open them out
Is that
a little bit more.
breathing technique that she was trying
Well,
to
there'll
do?
be a number of things that
Things
will get you
different?
to
No
do.
worries.
We basically want to release tension around
Yep.
here, but not only when you're breathing, but when you're talking
And
as
that's
well.
why I get so breathless when I'm talking a lot and
Yes.
when I'm walking and
Yep.
exercising.
Yep. Yeah, because when you're talking, you're using far more tension in here than what you need to.
Right, right. Because I thought I was having a heart attack to start with,
Mhm.
and that was all cleared and fine. So
Mhm. Yeah. Well, this is showing some narrowing.
yes,
It's not severe narrowing, but it's probably something that we can help you to
Fix it up.
reduce.
good.
Okay. The laryngoscopy showed that the patient had two issues. One, it did confirm mild VCD, and that VCD was exacerbated during the odour challenge. The second thing it showed was some mild muscle tension during phonation. So there was constriction of the false vocal folds and there was anterior-posterior constriction, which is consistent with muscle tension dysphonia.